On shift tonight, Registrar Dr. Chris Carson.
Can I have a trolley? There's a rather grey-looking chap in the back corridor.
Sister Joe.
Smile. I'm smiling, can't you tell? Behind the mask.
And Consultant Dr. Sue Mason.
Are you quite fit and healthy otherwise?
No, I'm bubbling.
Oh, are you? Oh dear.
So get ready to share a shift.
Yo, you've done a proper job there, haven't you? I have, Better out than in.
At Barnsley Casualty.
Ready, steady, roll.
I think I'm gonna have a meltdown.
At Barnsley Hospital, Sister Joe has a 12-hour shift ahead of her, coordinating the casualty team.
Can we get that gentleman changed into a gown?
But she's already under pressure, as nursing staff have called in sick.
We're really, really short-staffed. We've got 3 untrained and 3 trained nurses short today.
When we don't have the right numbers of staff, it makes the department really challenging.
Everybody's got to do their bit and somebody else's bit as well to make up. Patients don't stop coming in because we're short-staffed.
We all work together as a team and we all help each other out.
With the team already overstretched, a 999 emergency is on its way. A man with epilepsy has been found with head injuries at the bottom of a flight of stairs.
Hello, CT, it's Chris, one of the ED registrars.
Registrar Dr. Chris Carson is called to resus.
Bye-bye. I love emergency medicine. You're at the cold face, you just do not know what's coming through the door. I think most A&E doctors do thrive on that. It gives us a buzz because it's what we train for.
39-year-old Wayne has learning difficulties, making it harder for the paramedics to assess his condition.
This way, he was found at the bottom of the stairs. As to whether he's gone down the stairs or not,
Okay.
no. No, that's it. Okay.
No, it's under investigation.
Oh, under investigation procedures. I think he may have banged his head.
Okay.
If you look at his breathing, that's what I'm unhappy about. And the best on 100% O2 we can get up to is 95% with no known breathing difficulties.
Yep. The first thing I'm thinking of is his airway safe? You got it? Good. Hello, Wayne.
Hello.
I'm Chris, I'm one of the doctors. Yeah. Okay. You're just in Barnsley A&E.
They definitely have a wheeze on the left side, and it's quite silent down his lower ones. Right. Yeah, okay, he's not paying with any pain.
Okay.
Your finger.
Always, airway is the most important thing. So I want to make sure that the airway trolley is near to the bed in case I need to support his airway. Deep breaths in and out for me. He is a bit silent in both places, actually. Just have a look in your eyes here.
Wayne's breathing is laboured, but his airways are clear.
Do you remember falling downstairs?
Yeah.
Yeah. Was it the full set of stairs you fell down?
Yeah.
Hold up. What happened?
Yeah, blacked out.
You just blacked out. Fair enough. Did you have a seizure?
I don't think you were seized yet.
Okay, so you might have just say blacked out and fallen down.
Yeah.
Okay, fine.
Dr. Carson is concerned that Wayne may have life-threatening internal injuries.
Wayne's fallen down the stairs at home. He's not breathing in quite well at the bottom of his lungs. Do a quick chest x-ray, just want to make sure he hasn't bled into his chest. He's got a bit of a bump on his head, so we need to make sure he hasn't had a bleed into his brain. In a lot of head injury cases, they can come into you fully alert and fully awake, and then subsequently an hour or two later, they can become unconscious because they've had a slow bleed inside their brain.
Nurse Abby is monitoring Wayne to check that his condition is not deteriorating.
Wayne, are you all right?
I'm not uncomfortable.
Uncomfortable, I know. So unfortunately, we can't do anything about this until you've had your scan, all right? No pain, just uncomfortable.
Really uncomfortable.
Yeah, we can't take these off just yet till you've had the scan, because you might have injured yourself quite bad. Just bear with us a little bit. We'll get you round, okay?
Wayne is taken for emergency scans to determine whether he has internal bleeding. Dr. Carson heads to the hub to help out with the staff shortages, but he's stopped in his tracks.
You've what, sorry?
Sorry, I've had to come in that way. I couldn't make it all the way around.
Okay, no worries.
Trying to get to A&E.
You're in it, but you did get to reception? Yeah, are you okay? You look a bit grey. Have a seat. You can just spot someone who looks incredibly sick, and he looks sick. Can I have a trolley? There's a rather grey looking chap in the back corridor. He's just walked himself in. He couldn't make out round to reception. The fact that he is staggered into A&E and couldn't make it to reception already is a red flag to me. He's sweaty, he's holding his groin. He looks pretty rubbish. Coming down a door that you don't really know where it's leading because you're that unwell, just to be in the hospital already makes me think that's not good. Think you managed to get yourself into this? Well, I'm Chris, I'm one of the A&E doctors. Got a free cubicle. Stick him in 6. Right, Paul, let's get you up onto this bed.
With the department understaffed, Dr. Carson can't wait for help, as this patient is in too much pain.
All right, thank you, bye.
Everyone is having to work harder than ever at Barnsley Casualty, as 6 members of staff have called in sick.
So now we've got 2 cancelled shifts, one for this afternoon and one for this evening as well. It leaves us mega short this afternoon.
And Dr. Carson is juggling 2 patients.
We'll see you in a few minutes, Wayne, all right?
While his 999 emergency patient Wayne is having a CT scan to check for internal bleeding.
Right.
In cubicle 6, 52-year-old Paul is suffering with extreme pain in his groin and abdomen.
What's been going on today then?
I've had kidney stones before. And I don't know what it is.
Kidney stones are pretty bad, actually. Patients become quite unwell, and in some cases, patients can die from a kidney stone.
I've had pain for the last two days.
Yeah.
I've been doing a lot of painting
Yeah.
and that in house, and I thought reaching and twisting and things like that.
Okay.
And I got pain
In your testicles. Okay.
But then this morning, I just woke up and I got really bad pain in my back.
Yeah.
And it's more on left.
On left as well.
Here, and I've never had it in here before.
Okay, so it's just in there.
That's probably the worst part now.
Yeah. And is the pain there all the time, or does it come and go?
No, it's there all the
Constant.
time.
And is it the same all the time?
Really sharp.
Sharp.
I feel as though I passed water, and I feel as though I can't.
When was the last time you had a wee?
About an hour ago.
Hour ago. Did it sting or burn at all? Did you notice any blood in there? No. Okay. Let's have a quick look at you then. So, is it okay if I just lay you down for a second?
Yeah.
If you need to be sick or anything, just let me know. We'll get the bowl for you. All right. So, is that hurting just where you're pointing there? When was the last time you opened your bowels?
A couple of days ago.
A couple of days ago. Okay. What age are you?
52.
52. I think what we'll do is we'll get a cannula into you, get some blood tests, and we'll give you some painkillers. All right, is that okay? Good stuff.
Paul is sent for an urgent CT scan to determine if a kidney stone is causing his extreme pain. Meanwhile, it's back to Resus Bay 3 to check on Wayne, who was rushed in by ambulance after falling down 12 stairs. Although he's stable, his breathing isn't.
Just sounding a bit wheezy around there.
Yeah, he does now.
See how it goes on the oxygen.
Just gonna pop a little bit of oxygen back on, okay?
No.
Your oxygen levels are just a little bit low. All right, so it'll help with your breathing. I'll just rest it on your face so it doesn't feel as enclosed. That feel all right there?
Yeah.
Lovely.
The scan results are in.
CT, no bleed, bit of a scalp hematoma. Yes, file report. No significant finding.
As Wayne has learning difficulties, his mum Angela is updated on her son's condition.
Because he's fallen from the top to the bottom of the stairs, we've done a quick scan of his head and of his neck, just to make sure everything looks okay. I've had a quick look through it, and it looks okay to me, but we're just waiting on a report from the X-ray doctors, the radiologists, just to make sure that that there's no kind of small bleed into his brain, or that he hasn't cracked any of the little bones in his neck. But we just need to kind of err on the side of caution. We'll just keep an eye on him for a little while, and we may be able to let him go home today. Speaking to Wayne's mum is really important because I get to let her know that her son is okay and that, you know, she doesn't have to rush into A&E. Good. I'll get him off this collar then. Right, Wayne.
Mine.
Good news. Your CT scan's normal. So brain's normal and your neck is good. So I'm going to take this collar off now.
So I can go home.
You might be able to later on, yeah. I think we'll just need to keep our eye on you for a little bit longer because your oxygen levels dropped down a little bit earlier. So if they stay okay, we should be able to get you home. So we'll take these off. Right, so if you bring your arms down to your chest, I'm gonna have a quick feel of your neck before we move it. So if you stay still, if I push there, any pain?
No.
Any pain there?
No.
And there.
No.
Good. Shall we sit you up a little bit? There you go. How's that feel? You got a stiff back now? Yeah. Right, if you sit back a little bit, I'm just going to pop this oxygen back on. There you go. So, relax for a little bit. Good stuff. But the good news is, no damage done.
But Wayne can't be discharged yet. His oxygen levels need to stabilise. In the hub, with staff off sick, Sister Jo is struggling to find anyone to triage patients.
Where's Becky gone? Walking round, looking for nurses, looking for doctors.
With a shortage of nurses to help assess patients, consultant Dr. Sue Mason is trying to clear the backlog of cases.
Mr. Brown, I'm Dr. Mason.
93-year-old Walt has his granddaughter with him for additional support.
What's been happening then?
Well, one of the bubbles have come off my hearing aid and it's right down in my ear.
Right.
But the actual bubble
Yes.
is in his ear, in his right ear.
Is it painful? Is it painful?
No.
It's not painful.
Oh, no. No.
He's done it before.
Last time it went at two or three me here, isn't it?
Two last time. There were two bubbles stuck in it last time.
Yeah, besides something else.
And some cotton buds.
And then you feel dustbin out of me.
It's not uncommon to see somebody with bits of hearing aid stuck in their ear.
And two earbuds.
And those are fun things to try and deal with and sort out for them.
How you think your bubble came off?
You're not very strong, you know, and if you're a bit rough, it either drops off or it stops in your blooming ear.
You've got to be gentle, Grandad.
Well, never been gentle in my life.
And are you otherwise quite fit and well?
Am I what?
Are you quite fit and healthy otherwise?
No, I'm buggered.
Oh, are you? Oh dear. Well, I may not be able to do it, but I'll try. If not, we'll get you to the ENT department, just because if it's quite far down, sometimes they are a little bit tricky. So we will see, and I don't want to cause any damage. Okay? I might need one of the nurses to help me. It's quite hard to see, but if there is a bit of clear plastic in there, and it's just wedged in, and I think I can probably just grab it. This is tense. All right. Ta-da!
From bottom of your hearing aid? Yeah.
They always fall off these, you know. What I'm going to do is have a look behind to make sure there's nothing else there.
Yeah.
Beautiful. All right, you're all sorted.
Right. Put your cap on and I'm just going to wash my hands.
Right.
Right, he's in order.
Right, you're all sorted then, all right?
Thank you
Thank
so
you very
much.
much, dear.
Pleasure, nice to meet you.
I'm really pleased that we've been able to retrieve the missing part that he can use again if he needs to, and send him on his way.
Hold on.
Yeah,
Right, we're away.
Righty-ho.
Alex, have you had your break, love? Yeah.
In the hub, With a shortage of nurses, Sister Jo is still struggling to get patients seen.
Everybody needs something. Everybody needs moving or treatment, and there's not enough of us to do it. It's just...
And waiting times are starting to rise.
They come and have a meltdown.
Trying to clear his own waiting list, Dr. Carson has Paul's CT results. He hopes they'll reveal why Paul's been suffering from severe groin pain.
Let me see if I can see anything. He's got a little stone there. Just there, should be a tiny, tiny little stone. Yeah, the rest of it looks okay. In most patients, these pass themselves. So most patients will actually, it'll fall out of the tube and the patient will just wee it out. But in Paul's case, it seems to be a bit stuck in the tube, and that will be what's causing his pain because the tube is trying to squeeze the stone out. Hi, Paul. You're still in pain, are you?
Worse.
It's getting worse. So it looks like you probably do have a little stone in there, all right? So what I'm gonna do, we'll give you more painkillers. I'll ask the nurse to come back and give you some as an injection. And we'll give you some anti-sickness as well. No, I'll get you a bowl, don't worry. Here you go. Better out than in. We'll give you some anti-sickness, all right? Okay. Well done. Horrible. Is the pain still in the same place?
All right. In the pit whistle.
Yeah. So you've got, yeah. So yeah, so you've got a little stone just in the tube that connects your kidney, which is back here, to your bladder, which kind of comes around toward the front. So that'll be the culprit. That'll be causing this pain. In most cases, it falls out, but in some cases, we have to ask the surgeons to kind of go fetch it, all right, with a little kind of camera. So we'll give you some more painkillers, give you some anti-sickness, and I'll ask the surgeons, the urologists, to come and have a look at you then, all right? No worries. We'll get you sorted out, Paul, okay? Stones are horrible. I would not want a kidney stone. So I drink as much water as I can to try and prevent that. So hydration is the best way to prevent kidney stones.
Paul was monitored overnight before being discharged. Medication helped him safely pass the stone.
Are you all right?
One patient may be leaving, but Sister Jo is struggling to keep the patient flow moving in Casualty.
Oh, that chap's gonna go into number 5, but it's not cleaned yet.
With the nursing team depleted, patients are backing up.
At the moment, we've got 45 patients in the department, which is a hell of a lot. At 45 at this time of day is not a healthy position, really.
And new patients keep arriving. Nigel has deep lacerations from a DIY accident with an angle grinder. With no nurses to do an initial assessment, Junior Dr. Tariq Khan is assigned the case.
I'm originally from Pakistan. My grandma had some brain tumor. Looking at her sufferings, it made me even more motivated to become a doctor. Being a doctor in England is kind of like a dream come true. Hello, my name is Tariq. And now here I am in Barnsley. So, what brings you here today?
I got an angle grinder and it snatched, but it pulled it straight out of my hands. It flew it up in here. I ducked back and it landed on my leg. The chainsaw was out of my control.
I'm just gonna have a quick look. Okay, so that is just superficial. Right. So you said it's stinging rather than hurting?
It's not hurting, no.
Okay. Nigel doesn't look in that much pain. Looking at his wound, you would expect him to be screaming at something like that. If the wound gets very deep, you don't feel the pain. Are you in any pain? Do you need any painkillers?
No, it's just stinging, that's all.
Junior Dr. Khan needs to urgently get a second opinion. Nigel's wound is so deep, he may have severed vital nerves. At Barnsley Casualty, the nursing team has been hit by sickness, so the whole department is facing an uphill battle.
It's been really, really busy. Patients coming in left, right and centre. Try and just weather the storm a little bit and then try and get a bit of flow back.
To add to Sister Jo's pressure, there are no beds available.
So it's pretty dismal, to be fair, but...
If we had beds upstairs, it'd be lovely.
There'd be half as many patients, yeah.
Half the patients would be gone and we'd actually have a nice shift for once.
And there's a backlog needing to be seen.
We're just having a huddle. Do you want to join us?
Too busy. There's too many.
One of these is Nigel, who severed his leg when an angle grinder slipped out of his hands during some DIY. Due to the severity of the wound, Dr. Calm wants a second opinion from Registrar Dr. Dan Buick.
So the wound is around 13 centimeter long and around 3 to 4 centimeter wide. It's not bleeding currently. We're going to stitch it on surgeons because it's quite wide.
I'll come and have a quick glance here. Description, just give it that size.
Yeah.
My name's Dan, I'm one of the other doctors. Now I hear this is a recurring theme, DIY injuries.
DIY injuries, yeah.
Okay.
I've done that finger on an hydraulic cylinder.
Yeah.
That thumb on a saw, stainless saw.
Yeah.
And I banged my head on my van and got my Harry Potter scar.
Right. Yo, you've done a proper job there, haven't you?
I have. Only protection didn't have on were leggings.
I don't think leggings would have helped you very much unless they were chainmail leggings.
With Nigel's injury, it was quite a gruesome thing. My focus was not on how bad it looks, my focus was to make sure we do the right thing and as quickly as we can.
Tell you what it reminds me of is when you watch them films on telly and they cut it blubber up on whales and things, you know, it's so like that.
I'm not stitching that up in the emergency department.
No.
You're at high risk of it getting infected. It needs a proper washout, and then we'll need lots of some deep sutures and then some more superficial. Refer you to the orthopaedic team, and they can sort from there. Well done. Yeah. Good work.
Good work, yeah.
Thanks for keeping us in business.
Nigel's DIY injury is so severe, he needs to have an X-ray to check that he hasn't chipped or fractured any bones.
There's only so much we can do.
I know.
Our hands are tied.
Yeah, I have not got the manpower, unfortunately.
In the hub, with nursing staff numbers down, waiting times are up. Sister Jo calls an emergency meeting.
So we have got 20 patients with an hour and 42-minute wait. We've got 2 ambulances waiting to hand over as well.
You know, you might be short-staffed, but we have to do what we can with the numbers we've got.
If we got more staff, then we'd have a bit better run on things.
But we try to pull together.
And just carry on regardless. Thank you.
The pressure filters down to the medics, and that means there's no let-up for Dr. Carson.
So kiddies to be seen next. So 4-year-old Pippa. Cool. Whenever it is busy, that's actually when the A&E teams, I feel, are at their best, because they're doing what they know how to do. They're trained to work whenever things are a bit chaotic.
In Pediatric Casualty is 4-year-old Pippa. She's been brought in by Mum Jodie.
Hello, is it Pippa? Hi, Pippa. My name's Chris. I'm one of the doctors. So you've been a bit poorly, Pippa, is that right? What's been going on then, Mum?
Well, about 6:10 this morning, she decided that she was going to be sick. And then since then, she's just carried on being sick. We've had really high temperatures of like 40, 39, but she's been sick a couple of times since we got here as well. So we're just trying to get fluid down her now, but she's still
bringing some stuff back. And the stuff coming up, is it just the fluid that she's been drinking? Yeah. Okay. And has she been complaining of any pain in her throat or any pain in her ears?
No, she did say her stomach was hurting this morning, but nothing since.
Fine. Any diarrhea?
No.
Okay. Who's this? Monty. Does Monty make you feel better?
Yeah.
Good. Right, let's have a little look at you then. Working with children can be a bit complex because you do have to work out how to communicate with them. You know, most children will say ow if you kind of poke them or, ask them, does it hurt? They'll say yeah. Let's have a feel behind your ears. This is usually a good place for tickles, yeah. So working out what they actually mean, and there is a skill to that, to actually examining them and getting a lot of stuff from Mum and Dad. Pippa, can you do a big deep breath like a big... Good, well done. Let's have a listen to this tummy as well. Let's see if I can hear your breakfast.
What breakfast?
No breakfast in there. And say, ah. I'm gonna pop the lollipop stick in for a second. Oh, that's fine. So, yeah, tonsils are a little bit big, so I suggest, you know, I suspect if she's had a little bit of a cough, bit of a red throat, you know, it all sounds very virally. So I think we'll keep an eye on her for a little bit longer. We'll keep going with this kind of fluid trial, see how we get on. Ideally, we should just get a wee sample as well. All right, so yeah, so we'll pop back in a bit.
Yeah.
You're welcome, thank you. You're very good, very brave. All right, good girl.
Thank you.
No problem.
Pippa will be closely monitored over the next hour to see if her temperature decreases and if she manages to keep down any liquids.
Somebody pinched out nursing staff.
A shortage of nurses means that staff haven't got time to stop for a break. So, a pick-me-up is brought to the hub.
Dr. Mike has kindly offered to pay for coffees for us. It's not often it happens, so you grab it while you can.
Look, mine's in the bin already.
Have you drunk it?
Yeah.
I'm a sucker for a latte.
But there's no time for coffee for Dr. Khan. He's got Nigel's x-ray results. Following a DIY accident with an angle grinder, Nigel has a 13cm laceration on his thigh.
I don't see any fracture. Yeah, it seems totally fine. I don't see any bony injury involved at all.
With no fractures, Nigel will have his wound bandaged until he can have surgery to close the 4cm wide laceration tomorrow.
From having a chainsaw in my leg, I feel as though I'm doing pretty well.
Hey Nigel, my name's Brian, I'm one at Nurses and this is Lisa. Just come to dress your wounds when you can go home.
It's fine.
Just keep it nice and steady for me, my love. Just going to pop this dressing off. Just get a little bit of a clean, sweetheart. He's only water, don't worry. Stop being so pappy. He's a crack at that, mate.
Aye. That don't hurt at all.
Does it not? Have you not got any feeling in it?
Well, I can feel you doing it, but it doesn't hurt.
Did it hurt when you did it? Oh, I take it back when you're not happy at all. I'm just going to hold it together a little bit. I'm going to pop this on.
That sticky.
This is the sticky. All right, you got it? Yeah. It's doing really well not to bleed that.
Didn't bleed much at all.
Did it not? You've been very lucky there, I think. That feel better?
Yeah. I feel as though that I've had a really lucky escape and I could have been really a lot worse.
So we've just got some antibiotics for you and then you're free to go.
Right, thank you.
I don't think we are going to stop him DIY stuff, but it will be better if he just do it a bit more carefully.
The following morning, Nigel went to theatre where they successfully stitched up his leg. With one emergency dealt with, in the hub, Sister Jo is faced with another.
It's fallen. On my way. You alright, darling? You'll stick yourself up first. Oh dear me. Did you bounce?
Yeah.
With the patient safely back on the bed, Sister Jo leaves him in the care of Nurse Jess.
I'll need a chair.
In resus,
You got a stiff back now? Yeah.
Dr. Carson is still juggling patients. He's monitoring Wayne, who hit his head while having a seizure.
Wayne is an epileptic with learning difficulties. He has had lots of seizures in the past. So him coming to A&E following a seizure and a head injury is pretty normal for him. You okay, Wayne?
Your chair.
Your chair. Are you in pain?
There.
Whereabouts?
Stomach.
In your stomach, okay.
I get that though when I'm laid down a long time.
Do you? No worries. Well, I'll get you a chair. So let me take the side of that bed down, otherwise your leg will get stuck there. There you go. I think, hang on, wait. I think you're still connected up here. Wait. Let me just take your chest ones off there. You should be released. All right, so if you stay there, we'll keep a little eye on you, and then we'll come back and see how you are in about half an hour, all right? Good man. He understandably doesn't feel like he needs to stay in A&E and he wants to leave the department.
Wayne leaves because he knows his mum is outside waiting for him.
He left the department a little bit earlier than I would have wanted him to, yeah.
Wayne was discharged back into his mum's care and now has a specialist epilepsy nurse visiting him weekly. But there's no rest for Dr. Carson as he heads straight to Pediatric Casualty to check on his patient, 4-year-old Pippa.
Hello.
Mum Jodie brought her in after she vomited continuously.
How are we doing?
Been sick quite a bit of time.
Oh, okay. Oh yeah, you have, haven't you? Oh dear.
What we've tried.
Just not happening. Fine. How are you feeling? You're feeling good.
There's the lights in your eyes, that's why
Oh,
we keep
is it?
turning
Okay.
down.
That's fine. So the reason that we keep pushing for a wee is, number one, to make sure there's no infection, but also it's good to see them wee because it means that they're getting enough fluid in to make wee, basically. Because if you're not doing that, then you're definitely dehydrated and need topping up with a drip. So I think for now, I'll give the paediatric team a ring. We'll get her up to CAU, the assessment unit, and they'll just keep an eye on her for a bit longer. It'll just be more of the same for a while, and then they'll make a decision. All right.
Thank you so much.
No problem.
With no improvement in her condition, Pippa is transferred to the hospital's paediatric ward.
Hiya Pippa, should we go upstairs, chicken? I know you're having a sleep.
After staying on the ward for another 4 hours, Pippa was diagnosed with a viral infection and sent home with medication.
Just round here to the left.
In the hub, staff have been drafted in to work an extra shift.
Hiya. Are you with us, my dear? Brilliant. Will you stay up on this side for me?
Yeah.
Is that all right? There's been a bit manic.
But it's going to take time to get through the backlog of patients, so Dr. Khan moves on to his next case. Waiting to be seen is 25-year-old Alicia, who was thrown from a horse while attempting a jump.
Hello, can you tell me why you're here today?
Come off horse and landed on my head and hurt my head and neck.
Were you riding or was it when you just got onto it?
We were heading towards the jump, but she spun round and
Okay, and that's why you fell.
yeah, I was laid on the floor
Okay.
and my legs were not numb but it was like jelly.
Okay. Anybody with a neck collar on, you are always a bit worried, and you want to rule out any spinal cord injuries. So that is what's going on in the back of your mind. When you fell, the first thing touching the ground, was it your feet or your head straight away?
My head.
Your head?
Yeah.
So you banged your head first?
Yeah.
You were wearing a helmet?
Yeah.
Okay, fine. Right, okay, so that should have helped. But because she is painful, you want to make sure there is no fracture or any problem with the cord in the spinal cord. But if there is any damage and she keeps moving it, it presses on it, then she can even end up being paralyzed.
Dr. Khan calls in Registrar Dr. Charlie Player for a second opinion.
At the moment, where do you have any pain?
My neck, the back of my head.
Anything down your spine?
No.
No. Hands and feet, any sort of tingling, numbness?
No, it's just a shake.
And you fell backwards and sort of landed at the top of your head and neck?
As far as I know, I was in the head first and then level.
Okay, so...
A team are called in so that Dr. Player can assess Alicia's spine, while Sister Benita keeps her neck immobilised.
Okay, ready, steady, roll.
Right, so I'm just going to press down your spine, okay?
So yes or no?
Any pain?
No.
No? That's all right? That's painful? A lot or little? It hurts a lot? Alicia, does that hurt? Yes or no? Yeah? Okay.
With Alicia struggling to answer due to the pain, she'll need an urgent CT scan to determine if she has any spinal injuries. At Barnsley Hospital, a nursing shortage has put the team under pressure all shift. Emergency nurse practitioner Claire has been treating a long line of walk-in patients in the minor injuries unit.
Yes, please.
Waiting to be seen is John. He's struggling to get around in his wheelchair following a bad fall.
Do you want me to push you in?
Yeah, you will. Thank you. See you in a bit. If I'm not back in half an hour, send a search party.
I was 30 when I started my nurse training, and I thought about it when I was younger, but felt that I'd not got the life experience. So I waited. I was a mature student. So my name's Claire. I'm one of the nurse practitioners.
Right.
Okay.
Yes.
So tell me a little bit about what's brought you to A&E today.
I just basically was transferred onto my wet room toilet, disabled toilet. Lost my balance and just went over, literally sideways, landing on this part of my shoulder. But as you can see, I'm quite stocky, so I just sort of brushed it off and thought, what an idiot, like you do.
What do you feel like you can't do with your shoulder?
Well, I can get that there, which is handy for pulling like my underwear up. But that arm,
Okay. So you feel like your power's reduced a little bit in that arm, has it?
mobility more than power.
In John's case, it's really, really important that he doesn't lose the function of that arm because he needs that to get around in his daily life. Normally be able to move that thumb in that position like that?
Yeah, normally able to do that.
Yeah.
See my thumb? Look, it's there, but it's like running at, what, 75%?
Why are you in a wheelchair?
I was born in a wheelchair.
Right.
Well, I wasn't born in it. I've never walked in my life.
Right, OK. So I think we'll do an X-ray just to make sure that we're not missing anything on your shoulder.
John will need scans to determine if his fall has damaged his shoulder and his mobility.
OK, right. I'll pass that to you. Down for an X-ray.
In the hub, the team is trying to clear the backlog of patients.
Struggle this morning with male beds and struggling and hot beds.
Dr. Khan and Registrar Dr. Johnny Cooper are reviewing Alicia's scans for spinal injuries following a horse riding accident.
Looks all right, doesn't it?
Yeah.
I can't see anything nasty.
Yeah. Hello, Alicia. So your scan has been reported totally normal, which means we can take this safely off. I love horse riding. When I was doing my first riding class, it was in the military school. We and 3 of our friends, we all fell off the horses. But it's a very good feeling once you learn how to ride.
Just don't lift my head up.
A little bit painful.
Yeah.
Yeah, it's gonna be.
I was worried as soon as it happened, the fact that I couldn't feel my legs and it went numb. I just panicked. But at least I know it's all right now.
Just take your time.
But Alicia will not be able to go home until she can walk unaided.
Was that patient in ADC1? Oh, no.
All shifts, Sister Jo has been dealing with staff shortages, but order is starting to be restored.
All calm in resource, that has to be a bonus. Looks like a bomb site, but it's calm. Looks like a bomb's dropped in resource. What have you done? What have you done?
I'm just going to go sort it out now.
Right. Will you just make it safe?
Yeah, yeah.
And then will you go straight for your break?
Yes.
Of course I will.
Absolutely.
John is in X-ray to see if a recent fall has damaged his shoulder and hand, reducing his mobility.
Right, so we're done, so we'll get you back training.
After looking over the results, Nurse Claire brings John in to give him the verdict.
So your X-rays look okay. I can't see anything obvious on your X-rays. Nothing that's broken. Yeah, we've done that bit. The problem is with X-rays, it only shows the bony injury, so there could be a potentially that you've got some ligament damage in there. So we'll get the physio to see it as well, okay?
Yeah.
From your thumb point of view, I've done an X-ray on that as well. So you've possibly injured the thumb and not realised. So you have a ligament that stops the thumb from bending right back, okay?
Right,
So it could be that potentially that has been damaged a little bit.
Right.
We can refer you to the fracture clinic doctor
So we'll splint it and put you like a thumb extension on just to keep the thumb stable. You might need to take your watch off.
No, it's not a watch. It's a smart watch.
All right.
Yeah. In fact, 2,100 and so much steps, and the feet have touched the floor.
So that goes right into there.
Yeah.
A week later, John had an ultrasound, which confirmed he'd torn a vital tendon in his thumb.
Yeah, not bad for a lady driver.
I wasn't going to say that.
I said it before you.
Yeah, thank you.
All right.
Turn left here. And that's the way out, I think.
10 days later, he had an operation, and his arm is currently in plaster. Also hoping to go home soon is Alicia. She had a horse riding accident and is updating best friend Steph.
Yeah, well, there's no rush. I think they said I've not done anything. It's just going to be aching.
There's nothing broken or anything?
No, I'm not dying. Bye.
Hello, is it Alicia? Good to get down then, sweetheart? Yeah. Is the horse alright?
Yeah, absolutely fine.
Is Bailey?
Yeah.
Are you alright?
Yeah. Better now, I know.
Yeah, you feel alright to mobilise?
Yeah.
So is somebody coming to pick you up, are they?
Yeah.
After leaving Casualty, Alicia was back in the saddle 5 days later. It's the end of a back-breaking shift for the Casualty team.
Working in as an A&E doctor does give you a lot of positive feeling about the human race. And it's a cup of tea. I didn't put any sugar in. Do you take sugar? From birth all the way through to death, you can really make a difference in thousands of people's lives.
Smile. I'm smiling, can't you tell? Behind the mask.
And for Sister Jo and her team, it's time to hand over to the night shift.
So, there's 25 patients in yellow.
I love being a nurse. It's all I've ever wanted to do.
Waiting time's about an hour and 10, an hour and 20 both sides. That's how we are at the minute.
I can't imagine having a different job or in a different area, really. It's a mint place to work.